Good morning, everyone. I'm calling to order this hearing of the Health, Finance, and Policy Committee. And people do keep calling it Health and Human Services, and it kind of is now. But formerly Health, Finance, and Policy. So we do have a quorum present. Thank you all for getting over here quickly from the floor session. And so today we are going to ask our nonpartisan staff to walk through House File 2930, or the DE, I should say, that's been posted to House File 2930. And so members, my thought today is we'll allow the nonpartisan staff to walk through first the spreadsheet, I think, and then the text bill. And if members have clarifying questions, please raise your hand and let us know. But today is not to debate the bill, to talk about why something should be in or out. It's just to get clarifying information from the nonpartisan staff. So it's for us to do that, because obviously there's a lot in the bill. There's always a lot in HHS bills. And some of it is obvious, some of it is technical. But this is just for us to all understand what's there, at least to some level. And then tomorrow we will take testimony on the bill, and that is all we will do. So you'll have an opportunity to hear from various members of the public and the lobbying community about what they like or don't like in the bill. And then the amendment deadline is tomorrow at 5 p.m. Now, your amendments all have to be drafted by our nonpartisan staff, so get them in early if you think you're going to want to get something done. Don't wait till 4 p.m. because they might not be able to do your bill. So I think they really want your amendments by 9 a.m. in order to get them drafted, if you can. I don't know, maybe staff wants to address that issue.
Madam Chair, members, I think 9 a.m. deadline tomorrow would be ideal, and if that doesn't happen, we'll do our best.
Yeah, thank you, Mr. Chun. They always do, but, you know, because they have a tremendous workload, if you have an amendment, you know you're going to want it, let them know early so they can balance their workload, because they, of course, are working very, very hard at this point in time. So with that, I'm going to call on... Oh, and we do have minutes, so let's adopt the minutes, approve the minutes. So we have minutes from March 14th, 2023. So do we have a member who has reviewed the minutes? Representative Quam.
Thank you, Madam Chair. I would move the minutes.
All right, thank you, Representative Quam. So motion to approve the minutes. All in favor, please say aye. Aye. Opposed? The minutes are approved. Okay, so with that, Mr. Harney, please go ahead and walk us through the spreadsheet.
Chair Liebling, members, you should have in your packet a spreadsheet titled on the top left-hand corner, Health, Finance, and Policy Budget. On the bottom right-hand corner, it should be dated March 27th, 2023 at 10:45 a.m. I'm looking around for confirmation that is correct. Great. So to pull back a big picture for a second here, the spreadsheet here is just the change items. The Ways and Means Committee adopted a budget resolution last Wednesday, putting a limit on spending, including the base for this committee, for approximately $4,295 million. This hits that target set by Ways and Means approximately. And the top line numbers, I'll go through quickly here. Net fiscal impact on line 3 for all the entire bill for all agencies is $791 million in fiscal year 24-25 and $564 million in the tails.
And
again,
Mr. Harney, just
yeah.
one sec. So I'm looking at the...
line 5.
Okay.
Line 5.
All right, just want to make sure we're all on the
Yeah,
same
yeah.
spreadsheet. Okay.
Yep, we are. Thank you, Chair. I had mentioned this before in committee, but the next line 6, the general fund appropriation, this includes the financing from the Healthcare Access Fund for medical assistance. So if you back that out, and we'll get that later to the spreadsheet, the House bill has a net total spend of $736 million and $408 million in the tails after that's backed out. I'm going to turn and start going through the provisions beginning on page 2. Line 86 begins the provisions for the Department of Human Services. On line 88, the DE, as a clarifying point, the DE Article 2 has a package for healthcare that some of these items are carried on the House columns that the governor has separately. So I will get to the House provisions later in the spreadsheet.
And just if I could just,
Correct.
because I've heard some concern about that as people have been reading this and, so I just want to kind of put a point on that. If you're reading with us and you see the House column blank on something, just don't freak out because it might be later in the spreadsheet, in other words.
Correct, Chair Liebling. So the first provision is a perfect example. Continuous MA eligibility for children will be discussed later. Going to line 98 is a provision the governor proposed, increasing the general assistance benefit amount and tethering it to the MFIP inflationary factor in the tails. The House is carrying that provision in their position. The cost for that is to the general fund of $21,659,000 in 24-25 and $61,083,000 in the tails. Turning to page 3, beginning on line 106, is a governor's provision for information technology service delivery transformation. This amount on the House columns is front-loaded, but carrying the full net amount that the governor proposed, primarily due to the House's decreased tail targets relative to the governor's amount. That amount for service delivery transformation in 24-25 is $51,836,000. Going to line 114 is federal compliance piece for MA eligibility modification for former foster care youth from other states. That amount is carried from the governor's proposal for $1.93 million in 24-25 and $1,126,000 in the tails. On line 121 is a proposal for modifications to housing stabilization services. The House position is to carry the governor's amount. That general fund total is $7,412,000 in 24-25 and $13,710,000 in the tails. Next, on line 132 is a governor's proposal for funding for Section 811 that the House position is to fully fund. That amount is $408,000 in both biennia. Two provisions that the House position does not carry that the governor proposed is funding for homeless management information system and funding for housing benefits 101. Line 147 is a governor proposal the House is carrying for AmeriCorps heading home Corps, establishing a state match. That amount is $2.2 million in both biennia. Turning to page 4 is a provision that the governor proposed that the House is not carrying in their position. That is a modification to MSA requirement for representative payee special needs payment. Line 155 is Representative Her proposal in House File 732 and a governor's proposal for a modification to the housing support countable income limit. The House position is to carry that at the governor's number for $4,762,000 in fiscal year 24-25 and $13,313,000 in the tails. Next on line 163 is a similar proposal as is in House File 732 and in the governor's budget for eliminating the tribal per capita payments for countable income and determining eligibility for general assistance, MSA, housing support, MFIP, DWP, and CCAP. A cost to the general fund for $271,000 in fiscal year 24-25 and $382 in the tails. Line 169 is additional funding for Bridging Benefits Program, a governor proposal that the House is carrying. The cost is $284,000 in 24-25 and $416 in the tails. And on line 174 is a governor's proposal for presumptive eligibility for housing support that effectively presumes as a exit incarceration 3 months of housing support eligibility for formerly incarcerated inmates, and that proposal is $2,360,000 in 24-25 and $3,502,000 in the tails. Line 179, 186 are governor proposals not carried in the House position. Turning to page 5 is the Minnesota Care buy-in Another example of a provision that the House is not carrying at this point in the spreadsheet, but does have an alternative proposal later. There's a mistake on the spreadsheet on line 198. This is not the same language as House File 2267, the Keeler bill. This is the same language as the governor proposes for modifications to MA payment methodology for tribal federally qualified healthcare centers. The House position is to carry that amount at $1,341,000 in 24-25 and $1,402,000 in the tails. On line 205 is a governor's proposal for improving MET's functionality. The amount in 24-25 that the House is carrying is the same as proposed at $18,033,000 and $966,000 in the tails. Line 212, line 217 are governor proposals that are not carried in the House position. Line 222, half of a portion of this proposal is carried later. The Ryer proposal and governor proposal to rebase the dental rates is not getting carried. So that reference to House File 1541 is in reference to the rebasing here, and the House position is to not carry the rebasing of the rates. Turning to page 6, line 238, another provision that the House will carry later that the governor proposed to for eliminating cost sharing and medical assistance. Line 245 is a de minimis cost for reimbursing providers for newborn screening in outpatient settings that the governor proposed and the House carries. Line 249 is both House File 1159, the Fisher bill, and a governor's proposal for drug formulary committee modifications. I will note that the House position is to carry the Fisher's proposed seat amounts, but then carry the governor's language eliminating the sunset for the drug formulary committee. This provides a savings to the committee's target of to the general fund of $59,538,000 in 24-25 and $78,642,000 in the tails. Line 255 is a grant to the Indian Health Board of Minneapolis for enrollment assistance, improved access to care, and COVID-19 vaccinations proposed by the governor that the House is carrying to the cost of $5,048,000 to the general fund in 24-25 and $2,526,000 in the tails. Line 261 is a proposal for modifications to Merck financing methodology and distribution requirements. This financing change to Merck has a general fund cost that the House is carrying of $33,540,000 in fiscal year 24-25 and $36,558,000 in the tails. The House position is to not carry line 267 funding to develop innovations in healthcare purchasing that the governor proposed. Line 275, where you see hashtags in the spreadsheet, indicates a budget-related proposal that has no fiscal impact. So this is a House position to carry the governor's proposal for modifications to the withhold provisions in the managed care contract that does not have a general fund cost. Line 277 is both House File 2395, the Bierman bill, and a governor's proposal giving DHS new authority to negotiate value-based purchasing arrangements for prescription drugs with the cost to the general fund of $529,000 in 24-25 and $552,000 in 26-27. Line 283, 285, 287, 289 are, again, hashtag items that do not carry any fiscal cost on the spreadsheet. Line 291 is a governor's proposal to increase the rate for reproductive health services in MA and Minnesota Care by, I believe, approximately 10%. That amount is to the general fund in fiscal years 24-25 of $433,000 and $84,000 to the Healthcare Access Fund, as well as $666,000 to the general fund and $133,000 to the Healthcare Access Fund in the tails. Line 300 is another IT item. This provides money for MMIS, Medicaid Management Information System modernization. The House position is to carry the governor's proposal for $14,141,000 in the upcoming biennium, and that amount is one time. Line 304 extends the authority to use audio-only telehealth in MA and Minnesota Care until June 3rd, 2025. There are costs to the Healthcare Access Fund. This is the governor's proposal, and there are costs to the Healthcare Access Fund and the general fund. On line 305 in fiscal year 24-25, there's $14,350,000 to the general fund and $1,188,000 in the tails. For the Healthcare Access Fund on line 306, that amount is $2,377,000 in 24-25 and $195,000 in the tails. Flipping to page 8 is a proposal for the governor to, as an operating adjustment and to maintain the current service level at the central office that the House position carries completely. It is split between the funding sources with a total cost to the general fund in this case of $38,915,000 in 24-25 and $47,474,000 in the tails. Line 325 is a governor's proposal for continuous improvement and compliance expansion. The House position is to carry that amount at $6,154,000 in 24-25 and $8,252,000 in the tails. Line 332 is a governor's proposal for provider licensing and reporting hub that the House position does not carry. Line 346 is the governor's proposal funding, providing additional funding for background studies operations. That amount is $1.5 million in 24-25 and $2 million in the tails. I will note that the House position is to carry the governor's proposal at half the requested amount in both biennia, excuse me. Line 351 is a de minimis background studies fee increase. And turning to page 9, on line 358 is a grant to establish tribal nation fraud prevention activities and an Office of Inspector General Tribal Liaison. I will note for the committee that this will change, that the impact to this committee should just be the operations cost to the central office, and that I believe Chair Pinto of Children and Families is funding the grant amount. So that amount will come out later. Lines 364 creates a new statutory chapter for public law background studies. That is a one-time cost to the general fund of $170,000. Line 369 is a governor's proposal to exclude census worker income for eligibility determination for various state programs, a cost of $79,000 in 24-25 and $26,000 in the tails. Lines 373 is a governor's proposal for establishing an easy enrollment optional checkbox that the House position does not carry. Line 379 is the DHS portion of the MNsure technology modernization that the House position carries at the fully requested amount. And that amount is $3,221,000 in 24-25 and $1,964,000 in the tails. I mentioned this at the top. This is the next one on 386. Line 386 is the financing provided from the Healthcare Access Fund for medical assistance. I will note, just for the record here, you'll see on line 389 in fiscal year 26. This is the general fund paying for a House healthcare package that has Healthcare Access Fund costs that I'll discuss later. On line 392 is the alignment that occurred last week to bring over a portion of the House Human Services Finance Committee to this committee's jurisdiction. Line 394 is a governor's proposal that the House is carrying for modifications to provide a requirement for SUD comprehensive assessments. Turning to line 10 is another no-cost item that the governor proposed that the House is carrying, establishing a floor for county and tribal administrative assessments. Line 402 is research to develop recommendations for a new BHF county and tribal administrative allocation that has $170,000 one-time cost that the House is carrying. Line 407 and 408 is a portion of the Edelson Bill in House File 1706, providing additional funding for housing with support for adults with serious mental illness grants. The House position is to carry the governor's requested amount of $6,376,000 to the general fund in fiscal year 24-25 and $6,402,000 in the tails. Line 414 is a governor's proposal to establish additional funding for projects for assistance in transition from homelessness grants. The House position is to carry the governor's proposed amount in fiscal year 24-25 only, and that amount on line 415 is $23,126,000 in the upcoming biennium. The House is choosing to not fund the governor's proposal on line 422 for public awareness campaign to promote access to SUD treatment services. On line 428, the House is funding the governor's proposal for an adult mental health initiative grant to White Earth Nation. That cost to the general fund is $600,000 in the upcoming biennium one time. Line 432 and 433 relates to House File 2058, a Hassan bill, and a governor's proposal establishing funding for cultural and ethnic minority infrastructure grants. The House position is to take the governor's money proposed, and that amount to the general fund is $20,407,000 in 24-25 and $20,438,000 in the tails. On line 439 and 440 relates to House File 1436, a Vang proposal, and the House position is to take the governor's proposed funding amount for additional funding for mental health provider supervision grants. That amount is $10,407,000 in fiscal years 24-25 and $10,438,000 in the tails. Line 445 is funding for new psychiatric residential treatment facility startup grants. The House position is to carry that at the requested amount from the governor for $2,195,000 in 24-25 and $2,208,000 in the tails. Line 452 is a governor proposal for specialization grants for PRTFs. That amount is carried at the requested level of $2,295,000 in 24-25 and $2,308,000 in the tails. Line 459 is a governor's proposal for modifications to Chapter 245C background study requirements. The House carries the proposal at the requested amount of $678,000 to the general fund in fiscal year 24-25 and $426,000 in the tails. The House is choosing not to carry governor's proposals on lines 468 for a tribal elder office, 473 for developing an emerging mood disorders program, and line 479 on page 12 to implement a mobile response and stabilization services grant program. Line 486 and 487 relates to the previously discussed House File 1706, the Edelson bill, and the governor's proposal for expanding access to first episode psychosis teams. The House position is to carry it at the governor's requested amount of $2,700,000 in 24-25, and the same in the tails. The House position does not carry a governor's proposal for additional operations staff for grants administration on 490. The House position carries additional funding for mobile crisis grants on 495 at the requested amount in the upcoming biennium only, and that amount to the general fund is $12,528,000. Similar story for line 502. The House position is to fund the governor's proposal establishing funding for tribal mobile crisis response teams in the upcoming biennium only, and that amount is $2 million in 24-25. The House is not carrying the governor's proposal on line 506 for additional funding for infant and early childhood mental health consultation. On line 512, the House position is to carry and track the public health emergency unwind separately. The committee heard Chair Noor's bill to this end last week, and so this provision is not carried in this bill. Line 523 on page 13 is a governor's proposal that the House position does not carry, and it's related to modifications to behavioral health licensing requirements. Same story on line 535. The House is not carrying the governor's proposal for modifications to adult residential mental health rule. Line 542 is a governor's proposal that the House is carrying for additional payment of cost for children's residential facility services that provides a savings to the general fund in the upcoming biennium of $1,000,000 $3,084,000 and $3,010,000 in the tails. Line 549 is a governor's proposal for adult day treatment services rate increase. That amounts to $943,000 in fiscal years 24-25 and $1,414,000 in the tails. Line 55 is a proposal that the governor provided for the online behavioral health program locator. The House position is to carry this at the requested amount, and that is $2,340,000 in the upcoming biennium, and the same amount in the tails. Lines 560 and 561 relate to Representative Bierman's proposal in House File 564 and a similar governor's initiative. I will note on line 561 that the House is carrying an increased amount for the grants in fiscal years 24 and a decreased amount from the governor's proposal in the tails. So the House position net is to carry additional funding for school-linked behavioral health grants of $20,439,000 in 24-25 and $5,272,000 in the tails. And then lastly, of the governor's proposals for DHS is a transition to community grant program, eligibility modifications, and funding increase. The House proposal is to carry this at a lesser amount than requested. The House position is to carry it at the general fund cost of $3,860,000 in 24-25 and $6,984,000 in the tails. That concludes the governor's request and the House position. Beginning on line 576 is the package in Article 2 that I discussed earlier. This contains numerous provisions in that article, beginning with the continuous MA eligibility for children, providing 72 months of continuous eligibility for children under the age of 6 and 12 months for the ages of 6 to 19. That amount to the general fund in fiscal year 24-25 is $21,299,000. And then in the tails, that has a cost of $95,544,000. Line 589 is House File 9, a portion of House File 96, the lawn bill that establishes Minnesota Care eligibility for undocumented Minnesotans. Line 590 is the cost to the general fund for administration at the department. Line 591 is what I mentioned earlier when we went back to the Healthcare Access Fund financing for MA. That was the offset for this cost amount, and the Healthcare Access Fund cost for establishing Minnesota Care eligibility for undocumented Minnesotans is $4,528,000 in 24-25 and $99,139,000 in the tails. Line 598 is House File 1030, a Liebling proposal to eliminate cost sharing in medical assistance, also a governor's proposal that cost the general fund $9,207,000 in 24-25 and $13,420,000 in the tails. Line 605 is House File 816, a Representative Hicks bill to provide for the ability to opt out of managed care. That provides a savings to the general fund of $7,038,000 in 24-25 and $24,838,000 in the tails. Line 617 is the portion of House File 96 that implements and pushes forward with the Minnesota Care buy-in proposal of the bill. Largely systems cost here to the general fund of $17,933,000 in 24-25 and $15,377,000 in the tails. Line 1752 is a Liebling proposal providing a prescription drug carve-out that cost the general fund $6,234,000 in 24-25 and $4,939,000 in the tails. On line 636 is a Fisher proposal for House File 693, a delete everything amendment for that bill that establishes a direct purchasing program under public programs and eliminates managed care January 1st, 2027 in public programs. The net cost in the upcoming biennium is $2,164,000 and provides savings in the tails of $115,438,000. Turning to page 16, I'm going to go through these quickly. These are MA coverage bills. House File 1574 is a Bierman proposal on line 649, providing MA coverage for tobacco and nicotine cessation products. House line 654, House File 2077 is providing MA coverage for seizure detection services. Line 659 is House File 210, a Bonner proposal providing MA coverage for long-acting reverse contraceptives. Line 666 is a ACOM proposal providing MA coverage for recuperative care services. And line 673, I talked about this earlier with the governor's proposal. This is the portion of the governor's proposal that just deals with adding in coverage for adult dental health. This does not rebase the rates. And that amount to the general fund is $20,853,000 in 24-25 and $33 million in the tails. Line 684, House File 390 is an ACOM proposal. This was a mistake in drafting. There should be a cost for systems here to update it, and that will be adjusted on Thursday. Line 689 is a Ryer proposal in House File 346. This bill establishes a rate bridge of 4% increase through to June 30th, 2025 for mental health. That amount cost $22,030,000 in fiscal years 24-25 and $6,293,000 in the tails. Turning to page 17, line 702, House File 1814, a Ryer proposal establishing a dental home pilot. That amount in 24-25 is $659,000 and $694,000 in the tails. And lastly, for member bills impacting the Department of Human Services is a Ryer proposal on line 707, House File 239, which establishes MA coverage for hospice, respite, and end-of-life care for children, a cost of $159,000 in 24-25 and $190,000 in the tails. That concludes the House position on items impacting the Department of Human Services. And next, we will discuss the House position for the Department of Health proposals. Line 716 is a 988 suicide and crisis lifeline. This establishes a surcharge of up to 25 cents for all cell phones and landlines to fund 988 suicide and crisis lifeline. There is a cost to the general fund in the upcoming biennium of $3,592,000 and a savings in the tails of $2,642,000. The House position on line 725 is to not carry the governor's proposal, but have a separate package in Article 2 for MDH for research and analysis to address growing healthcare costs. On line 329 are grants for peer-led adolescent and mental health promotion. The House position is to carry the requested amount in fiscal years 24-25 only. That is $5,580,000. Line 734 is a governor's proposal to advance equity through capacity building and research allocation. The House position is to fund that at a greater level in the upcoming biennium and not funded at all in the tails. It will be a general fund cost under the House bill for $3,972,000. We are going to page 18. The House position does not carry the governor's proposal on 739 to advance equity through community engagement and systems transformation. The House position is to not carry the governor's proposal for all payer claims database enhancements and in fact, carry a House position separate to that I'll get to later. Line 750 is SGSR, state government special revenue related, establishing living licensure and home care. Line 755 is state government special revenue related, providing additional funding for background studies. And line 759 is a governor's proposal eliminating the chronic condition spending report that provides savings to the Healthcare Access Fund. The House position on line 763 is to not carry the governor's request for grants to promote local planning for climate resiliency. The House also does not carry a grant to the Minnesota Community Health Worker Alliance on line 768, and the House is not carrying the grant to Minnesota Community Health Worker Alliance and MDH program evaluation on line 772. Line 777 is House File 639, a Bonner bill and a governor's proposal. The House position is to carry it at the governor's requested funding amount that has $10,035,000 in 24-25 and $10,110,000 in the tails. Line 782, the governor's revised budget provided increased funding for the Comprehensive Drug Overdose and Morbidity Prevention Act. The House position is to carry that request at the amount that the bill was introduced at instead of the revised version. And that amount at the introduced version was $19,416,000 to the general fund in 24-25, and the same amount in the tails. Line 789 is a governor's proposal for local public health outreach to address COVID-delayed preventative care that the House position does not carry. Line 794 is an MDH cultural communications program. The House position is to carry it ongoing at a lesser amount, and the House position provides $2 million from the general fund in 24-25 and the same in the tails. Another no-cost item, reinstating the Drinking Water and Wastewater Advisory Council. That was on line 802. On line 804 is a governor's proposal providing emergency preparedness response sustainability, strategic healthcare stockpile, and COVID-19 transition activities. The House position is to carry this at a lesser amount than the governor requested. The House position is to carry it at $24,800,000 to the general fund in 24-25 and $22,800,000 in the tails. Line 809 is a governor's proposal expanding reporting requirements for prescription drugs. The House position is to carry this at the requested amount of $1,480,000 in 24-25 and $1,226,000 in the tails. House File 712 on line 813 is a Ryer bill and a governor's proposal. The House position is to carry this at the governor's requested amount for additional funding for family planning special projects. That is $13,904,000 in 24-25, and that amount is added to the base ongoing. Line 818 is money the governor requested for MDH federal funds oversight. The House position is to carry that at the requested amounts ongoing, each biennia of $1,060,000. Line 832 is a proposal of the governor to establish a health equity advisory and leadership council. The House position again carries it at the requested amounts of $130,000 in each biennia. Line 826 is a governor's proposal for the Healthy Beginnings, Healthy Families Grant Program, and the House position is to carry that in the upcoming biennium only at the requested funding level of $23,905,000 in 24-25. Flipping to page 20, the House position does not fund on line 831 funding to continue operation of MN Help Me Connect. Line 835, the House position is to carry a lesser amount than what was requested for additional funding for home visiting. The House position provides $5 million in each upcoming biennia to the general fund, from the general fund. The House position on 840 does not carry the governor's request for the homeless mortality study, nor does the House position on line 844 provide funding for MDH activities to promote improving the health and well-being of people with disabilities. Line 849 is House File 347, a Howard proposal and a governor's item providing grants for lead remediation in schools and child care centers. The House position is to carry it at the governor's requested amount for $1 million in each biennia. Line 854 is grants to community water systems for lead service line inventory. This amount is not carried in the House position as it is being carried in House File 24 and is also a separate line item in the global framework budget agreement for lead service line replacement. So that position is not carried in this DE. Line 859 is the MDH maintenance of current service levels, and that amount is split between the general fund, state government special revenue fund, and healthcare access fund. The cost to the general fund is $17 million, and $17,435,000 in 24-25, and $19,152,000 in the tails. Turning to page 21, the House is carrying the governor's proposal for the Minnesota One Health Antibiotic Stewardship Collaborative at the requested amounts, and that is $624,000 in 24-25, and the same amount in the next biennium, or in the tails, excuse me. Line 874 is the state enforcement of the Federal No Surprises Act and Provider Directory Feasibility Study proposal. The House position is to carry that at the requested amount from the governor of $2,300,000 in 24-25 and $1,710,000 in the tails. Lines 878 and 883 establish two offices at the Department of Health. Line 878 is the Office of African American Health. The House position is to fund it at the requested amount of $4,364,000 in 24-25 and the same amount in the tails. And then 883 is an Office for American Indian Health, and that is funded at the requested level of $4,178,000 in 24-25 and the same amount in the tails. Line 888 is a governor's proposal for local public health system transformation. The House position is to fund it at the requested level in 24-25, which is $34,240,000, and instead fund it at a lesser amount than requested in the tails. The House position provides ongoing funding for $16 million in 26-27. Line 893 repeals the Woman's Right to Know and Positive Alternative Programs. That provides a savings of $7,358,000 to the general fund in 24-25 and $7 million and the same amount in the tails. Line 898, the House, for ease of administration, adjusted the governor's proposal from a healthcare access fund appropriation to a general fund appropriation for grants to expand the healthcare workforce. The House position is to fund this from the general fund in 24-25 for $13,520,000 and then $13,950,000 in the tails. Line 908 is a grant to establish school-based health clinics. The House position is to fund it at the requested amount, $3,364,000 in 24-25 and $5,966,000 in the tails. The House position does not provide funding for the governor's proposal on line 913 for sentinel event reviews for police-involved deadly encounters, nor is the House carrying the amount the governor requested on line 918 for strengthening public drinking water systems infrastructure. The House on line 923, the House position provides one time in the upcoming biennium funding for grants to support long COVID survivors and the monitoring of impact of long COVID at the requested amount of $6,292,000. The House position does not provide funding on line 928 for telehealth and libraries grant pilot program that the governor requested. The House position is carrying the telehealth study appropriation cancellation and carry forward on line 933. Pursuant to budget rules, this, even though it is a carry forward from a previous biennium, this has to show up as a cost in the next biennium, and that is $1.2 million. Line 937 is a trauma system fee increase in revenue adjustment. The net total general fund cost based on this adjustment is $874,000 in both biennium that the governor proposed and the House is carrying. Line 945 is a no-cost vital record surcharge remittance and reporting requirement that the House is carrying that the governor proposed. And then line 947 is a proposal for equitable healthcare task force that the House position does not carry. Line 951 is a reinstatement of the fetal and infant mortality case review committee that the House position does not carry. Line 956 on page 23 is a governor's proposal for HIV prevention health equity programming that the House position provides full funding for, and that amount is $4,534,000 in 24-25. Line 961 is a no-cost item, and then line 963 is a governor's proposal for uninsured and underinsured adult vaccine program. The House position is to provide one-time funding in the upcoming biennium at the requested amount of $2,940,000. Line 967 is a governor's proposal for clinical medical dental innovation, and it is funded at the requested amount of $2,364,000 in 24-25 and $2,484,000 in the tails. Line 972 is the MDH side of the ledger for the transition of Merck to a special revenue and new general fund appropriation. The House position is to carry the financing change and provide the general fund appropriation at the requested amount in each biennium. Beginning on line 991, we will move into House positions only. The House healthcare package in Article 2 at the Minnesota Department of Health on line 993 begins with a RIRE proposal from House File 2202 establishing a healthcare affordability commission. Excuse me, it's misstated on line 993. It should be a health affordability commission. The total funding provided to the department in the RIRE proposal amounts to $8,904,000 in 24-25 and $9,571,000 in the details. Line 998 is another RIRE bill, House File 1843, as amended, providing for a universal health care system analysis. This is provided, funding is provided at $5 million from the general fund in 24-25 and $508,000 one time in the tails. Flipping to page 24 is the online 1003 is House File 1700, a FICE proposal that is stated in the bill as the Keeping Nurses at the Bedside Act. There are two portions of this bill that the House position provides funding for. On line 105 is the administration of the proposals in the bill at the department. That's $3,011,000 in 24-25 and $2,102,000 in the tails. Line 106 is the portion of the FICE bill that provides grants to nurses, healthcare grants to nurses, workforce grants, to nurses, and that is $20,100,000 in 24-25 and the same amount in the tails. Line 1010 is House File 1059, a Richardson bill, providing supporting for the healthy development of babies during pregnancy and postpartum, a one-time grant for $260,000. Line 1015 is House File 1269, a RIRE proposal establishing one-time funding for a critical access dental infrastructure program. That amounts to $20 million. Line 1020 is a Bierman proposal in House File 1940 for a palliative care advisory council, $88,000 in each biennium. Line 1025 is a Bonner proposal for under House File 2160 for fetal alcohol spectrum disorder grants. That's $1 million in each biennia. Line 1030 combines two bills that the committee heard, House File 2749, a Wolgamott bill, and House File 1494, a Frederick bill, that provides grants to healthcare entities and providers for self-defense grants, and that is $10 million one time in the upcoming biennium. Line 1036 is a Bierman proposal under House File 402. The House position is to provide funding for a one-time public interest review under the bill and in the language, and that amount provided to the department is $2 million in 24-25. Line 1041 is House File 474, a Hewitt proposal that establishes a post-registry study and provides funding for the creation and maintenance of a system. So that is for 24-25, $2,185,000 to the general fund and $1,316,000 in the tails. Page 25, line 1046, House File 51 is a Richardson bill establishing Emmett Lewis Till Victims Recovery Program, a one-time funding of grants for $500,000. Line 1051 is a Liebling proposal for a woman's right to know repeal and regulation repeal. I will note that for the committee that this is being double counted and a mistake I will have to correct because the governor's position carries this same repeal. So we are carrying this amount twice, and that's my mistake. That the Liebling proposal provided $290,000 in savings in each biennia. Line 1056 is a Jordan proposal, Representative Jordan proposal in House File 92, increasing the elevated blood lead level. This amount is provided for administration of the increase at the Department of Health of $294,000 in 24-25, and $122,000 in the tails. Line 1061 is House File 2099 as amended, establishing a task force on pregnancy health and substance use disorder at MDH, and one-time funding of $100,000 is provided. Line 2505 is a Representative Lee proposal for labor trafficking services. This is funded from the general fund at $1,092,000 in 24-25, and that amount is one time. Line 1071 is a transfer from the general fund to the public health response contingency account in fiscal year 24, one time of $4,804,000. And lastly, for member bills on line 1075 is the Elkins All Payer Claims Database. I mentioned this, that the Elkins proposal is the House position, and it's a little bit more expansive than the governor's proposal. And line 1075 provides funding to the Department of $3,017,000 in 24-25 and $3,068,000 in the tails. With the health-related licensing boards on 1081, I'm going to skip that, or I'm going to quickly just go through it now. There's various levels of maintenance of current service levels and fee increases, but since this is all state government special revenue related, I'm going to skip ahead to line 1138 on page 27, which is, in this case, a general fund proposal for a health-related board that Representative Bierman had in House File 1032, which provides funding for the central repository at the Board of Pharmacy to hire 2 pharmacists. That's $936,000 in 24-25, and the same amount in the tails. On the same page, 27, line 1176 and 1177 are 2 Representative Hewitt proposals at the EMSRB. The first one on line 1176 is providing medical resource communications grants in the upcoming biennium one time, and that amount is $2,683,000. And then line 1177 is House File 621. Again, that's regional EMS program grants, $800,000 each fiscal year ongoing, added to the base. And Madam Chair, the last 2 provisions I have for you is, last 3, excuse me, that the House position carries is at MNsure. The House is carrying the MNsure technology modernization. I discussed earlier the DHS side of the ledger. This is the MNsure side. And then the House is carrying 2 proposals, is funding 2 proposals at MNsure under the long proposal in House File 96. There are costs for implementation of the public option, and then there's a temporary cost-sharing reduction subsidy for MNsure Gold plans that it provides $75 a month in subsidy until the public option begins in 2027. And lastly, the House does not carry any of the easy enrollment proposals by the governor. Chair Liebling, that concludes the spreadsheet walkthrough on my end.
All right, well, we don't applaud in committee, but I'm sure that we all feel that way, Mr. Harney. Thank you. I mean, just reading through it is a challenge, and I think everybody can kind of get a sense of the amount of work that goes into this behind all of these numbers. So thank you so very much for that. Let me just pause and see if there are clarifying questions right now for Mr. Harney. Representative Quam.
Thank you, Madam Chair. I understand the HF, but there are also notations of BH and HC. It might be nice for some of the new members to know.
That's Chair Liebling, Representative Quam, that's the coding of the governor proposals in the article. So BH would be behavioral health. That's what it would stand for. Yeah.
So, yeah, good question, Representative Quam. So these should be correlated to the change pages that we received, although I personally have never been able to figure out how you go from that code. You know, it's not really lined up in those changes in a way that's easy to do that, but maybe somebody else knows how to do that translation, but I don't. Thank you for the question. Okay, any other clarifying questions on the spreadsheet? And for members who are new, I think you get a sense of now you're starting to see how all the things we've been doing and hearing and talking about kind of how it shows up for us and how complicated it actually all is. Representative Ryer.
Thank you, Madam Chair. One minor thing on line 1166, the Rare Disease Advisory Council. Yeah, that's also House File 988.
Thank you.
Madam, can you repeat that?
Yeah,
please.
Yeah, could you repeat that, Representative Ryer? I couldn't hear
Yes.
you, I guess.
On line 1166,
1166.
the Rare Disease Advisory Council. That is also House File 988.
Yeah, thank you.
Madam Chair,
Mr. Harney.
if I may, I skipped this one. This is, the Rare Disease Advisory Council does not have a current law base. So this House position is to establish an ongoing base and provide a maintenance of current service level requirements. But the House position does not establish the governor's request for additional program capacity that was 2 additional FTEs.
Okay, thank you. Other, Representative Bonner?
Just a technical item. On line 487, it says House File 1706. I think that House file may be incorrect. That bill is on telehealth. Just a FYI.
Okay, thank you. We'll check that. There was a separate Edelson bill, and, yeah.
Traditionally, I have carried that bill, but
Oh, pull your mic, please. We can't hear you.
traditionally I have carried the first episode psychosis bill, and Representative Edison may have something as well, but it's not House File 1706.
Okay, thank you for that. Okay. All right, then. I think we can go on to the rest of the walkthrough. Again, thank you very much, Mr. Harney. And is Mr. Chun.
So Madam Chair and members, for the language walkthrough, we'll be using a document titled House File 2930, House File 2930DE1. It's titled List of Bills Included. It's a set of tables. So we'll be, jumping around by article. I'll start with Article 1. This is the DHS healthcare article. So Section 1, this is from House File 2900. It's a governor's recommendation to require health insurers to comply with federal third-party liability requirements. Then Sections 2 and 28, another governor's proposal to extend the use of audio-only communication for telehealth from July 1 of 2023 through July 1 of 2025. Then Sections 3 and 7 are from House File 210, requires the MA program to reimburse hospitals for long-acting reversible contraceptives that are provided postpartum. It also requires hospitals and primary care providers to provide information on contraceptive options. Section 4 is the governor's proposal, removes the authority for the department, counties, and tribes to recover overpayments that are a result of client error. And I'll just note that, that this section needs a technical amendment. It doesn't quite work as it's drafted. Section 5 is another governor's proposal. This provides that for hospital rebasing, for the July 1, 2023 rebasing, the base years are to be 2018 and 2019. So this is related to COVID. Section 6 is a governor's proposal. It updates the rate methodology for long-term acute care hospitals. Sections 8, 20, and 27 are from House File 1574. This expands MA coverage of tobacco and nicotine cessation. It allows competitive bidding for quitline services. And it also eliminates Minnesota Care cost sharing for these services. Section 9 is the governor's proposal. Provides MA coverage for persons under age 26 who are in foster care at age 18 and in another state's Medicaid program. Section 10 is from House File 898. This is the expansion of adult dental coverage under medical assistance, effective January 1 of 2024. Sections 11 and 12 are from House File 1159 and also a governor's proposal. This expands the membership of the DHS Formulary Committee, so this is from House File 1159, and it makes the, ensures that the committee does not expire, and makes the cost of dispensing survey ongoing. Then Section 13, this is a governor's proposal, allows DHS to enter into value-based purchasing arrangements for drugs. Sections 14, 26, and 30 are from House File 91. This provides that MA covers medically necessary abortions, also eliminates the limitations in abortion coverage under Minnesota Care, and repeals a related rule. Sections 15 and 16 are from House File 239, provides MA coverage of respite and end-of-life care for recipients under age 21 that's provided in a hospice that is not Medicare certified. Section 17 is a governor's proposal, allows doula agencies and individual treating doulas to be reimbursed without supervision. Section 18, another governor's proposal. It allows Indian Health Service facilities and certain tribal health centers to enroll as tribal federally qualified health centers. Section 19 is from House File 2077, provides MA coverage for seizure detection devices. Then Section 21 is House File 2081, provides MA coverage for recuperative care services for persons experiencing homelessness. Section 22 is the governor's proposal. It requires providers that are receiving supplemental payments as part of an intergovernmental transfer to provide the commissioner with the information necessary to compute these payments within 24 months of the request. Section 23, a governor's proposal. It removes the managed care plan performance withholds that are in statute. Section 24, another governor's proposal, allows the commissioner to reimburse providers for the cost of metabolic disorder testing done outside of a hospital or freestanding birth center. Then Section 25, a governor's proposal, increases payment rates for family planning and abortion services by 10%. And then Section 29 is from House File 1814, directs DHS to establish a dental home pilot project. So that concludes the walk to Article 1. Move on to Article 2.
All right, and Mr.
or-
Chun, I just, as you maybe take a breath here, I just want to mention to members who are doing this for the first time, this is so confusing. And one of the things that took me a long time to learn, maybe it's obvious to everyone else, maybe I'm just stating the obvious, the bill itself, at least by article, is written in the order of the statute books. And that's why when you take, you may have a bill and it has different pieces in it, and when you see it in an omnibus, the bill is perhaps not all together in here. So that's why when Mr. Chun is reading through this and you have this document we're going through under the sections, sometimes the sections are not next to each other. So this document is to help you find that whole proposal in the bill, should you care to go to the actual language. So I hope that that's a little bit clear. It is, kind of learning to read legislative language and follow along here is a bit challenging and takes a little time to get used to. So I hope that's helpful for folks, that the bill is in the order of the statute. So if you want to find a statute in here, it makes it a little bit easier. I hope is that helpful or not helpful, Mr. Chun, do you think? Is that helpful? Okay. All right, please go ahead.
So Madam Chair and members, Article 2 is the Healthcare Affordability and Delivery article. Sections 1 to 8 are from House File 2202. This requires the Department of Health to establish the Healthcare Affordability Commission and a related advisory council. It requires the commission to set annual healthcare spending growth targets by June 15th of 2024 for a 5-year period. And it also allows the commission to require healthcare entities to file and comply with performance improvement plans if targets are not met. Then sections 9 and 22 to 29 are from House File 96. This is the proposal that allows Minnesota Care enrollees to enroll in the program under a public option, so it eliminates the income limit effective January 1 of 2027. Requires an implementation plan to be submitted to the legislature, It also makes undocumented persons eligible for Minnesota Care effective January 1 of 2025. It also provides transitional state cost-sharing reductions for gold plans. Section 10 is from House File 693. This establishes a direct payment system for families and children under MA, and also adults without children, and also all Minnesota Care enrollees, effective January 1, 2027. So under this system, enrollees would receive services either through fee-for-service, county-based purchasing plans, or county-owned HMOs. And it requires DHS to present an implementation plan to the legislature. Then sections 11, 13, 17, and 21 are from House File 1752. This carves out prescription drugs from coverage under managed care contracts effective January 1, 2026. It also increases payment to disproportionate share hospitals and critical access hospitals to offset some of the potential 340B program losses. It also requires managed care plans to pay a dispensing fee equal to the fee-for-service dispensing fee. Then Section 12 is from House File 2286. This provides MA continuous eligibility for children under age 19 for 12 months, and also for 12 months for children 19 to 21, and for children under 6 up to the month in which they turn age 6. Sections 14 and 15 are from House File 1030. This eliminates MA cost sharing for enrollees effective January 1 of 2024. Then Section 16 and also 18 to 20 are from House File 816. This allows MA enrollees to opt out of managed care enrollment beginning January 1 of 2024. And then Section 30 is from House File 2202. It requires the Health Department to contract for an analysis of the Minnesota Health Plan, the Minnesota Care Public Option, and the direct payment system and other reform models. Requires the development of an analytic tool. It requires a report to the legislature and the commissioner by a contractor by January 15th, 2026. And also by that date, the analytic tool is to be made available to the Health Department to be used for future analyses. So that's Article 2.
All right, thank you so much, Mr. Chun. Okay. Any clarifying questions on any of this that we've been zipping through? Okay, not seeing any. Okay, so we can go on to Department of Health. Ms. Clarkfist.
Madam Chair and members, I'll go through the next 3 articles in the bill, beginning with Article 3, Department of Health. This is quite a lengthy article. Section 1 is a governor's proposal adding tribal nations to the entities with which the commissioner may cooperate during disasters to protect public health. The next series of sections, beginning with sections 2, 59, 80, are from House File 91, and they repeal or amend certain statutes governing abortions and make conforming changes. Sections 3 and 72 establish a tobacco use prevention account and appropriate money in the account to the commissioner for tobacco use prevention activities. Section 4 modifies requirements for when the commissioner must notify a provider following a review of a major spending commitment by that provider. Section 5 is a governor's proposal. It requires the commissioner to assess the feasibility of developing a statewide electronic directory of healthcare providers. Sections 6 and 21 to 27 are a governor's proposal relating to compliance with the Federal No Surprises Act and authorizing enforcement of that act. It also modifies provisions governing balance billing, continuity of care, and reviews of adverse determinations. Sections 7 through 20 and a portion of Section 203 is a governor's proposal modifying the Prescription Drug Price Transparency Act. Sections 28 through 33 and 195 are changes to the all-payer claims database, including changes to the data that must be submitted, the allowable uses of the data, and the entities required to submit data. It also requires a study on transparency of healthcare payments. Section 34 is a governor's proposal reinstating in statute the Advisory Council on Water Supply Systems and Wastewater Treatment Facilities. Sections 35 through 37, 126, and 127 are governor's proposals relating to lead testing and remediation in schools and childcare settings. Section 38 is a governor's proposal. It's the Minnesota One Health Antimicrobial Stewardship Initiative. Section 39 is a governor's proposal, the Comprehensive Drug Overdose Morbidity Prevention Act. Section 40 is a governor's proposal directing the commissioner to establish a cultural communications program. Sections 41 through 43 is a governor's proposal establishing an Office of African American Health, a related advisory council, and a grant program. Sections 44 and 45 is a governor's proposal establishing an Office of American Indian Health and a related grant program. Section 46 establishes a hospital fee and dedicates the revenue to trauma hospital designations. Section 47 modifies membership of the Rural Health Advisory Committee. Sections 48 through 52, 79, and 132 are a portion of the Keeping Nurses at the Bedside Act. These provisions establish loan forgiveness for certain hospital nurses and modifies loan forgiveness for nurses who agree to teach. Sections 53 through 56 and 183 and 184 are a governor's proposals on healthcare workforce initiatives. Sections 57 and 58 update and clarify processes for establishing fetal death records and requesting certificates of birth resulting in stillbirth. Sections 60 and 61 specify when birth record surcharges and vital records surcharges must be submitted to the Commissioner of Management and Budget. Section 62 allows a minor age 16 or older to consent to non-residential mental health services. Sections 63 to 71 define terms and establish requirements for classifying water service lines for purposes of lead service line inventories and replacement plans. Section 73, 83 to 85, and a portion of 203 require hospitals to comply with the guidelines for design and construction of hospitals and repeals rules governing physical environment requirements for hospitals. Section 74 is another provision from the Keeping Nurses at the Bedside Act. It establishes additional requirements for preparedness and incident response action plans to acts of violence that are established and implemented by hospitals. Section 75 to 77 require hospitals to screen patients for eligibility for certain health coverage or assistance and creates other requirements for hospitals related to billing. Section 78, 182, 196, and 197 establishes requirements for notice and review of certain healthcare entity transactions. It extends the moratorium on conversion transactions, requires the return of certain charitable assets to the general fund, and authorizes a study. Section 81 requires healthcare facilities to allow a designated support person with a pregnant patient receiving services. Sections 82, 87 to 94, 192, and a portion of 202 is another piece of the Keeping Nurses at the Bedside Act relating to requirements for staffing committees, development and implementation of core staffing plans, and posting certain information related to staffing. Also requires the commissioner to grade hospitals on compliance with their core staffing plans. Section 86 and a portion of 202 authorizes the cancer reporting system to share certain data with cancer registries in other states and with national registries. Sections 95, 188, and 189 is another piece of the Keeping Nurses at the Bedside Act, modifies requirements for adverse health event reporting. Section 96 modifies the definition of elevated blood lead level in the Lead Poisoning Prevention Act. Sections 97 through 105 amend provisions in the Lead Poisoning Prevention Act defining certain types of lead work and activities that may be conducted with or without a license. Section 106 changes provisions governing nursing home change of ownership. Sections 107, 108, and 177 are technical changes to provisions governing nursing home rates. Sections 109 to 112 modify requirements for home care provider surveys. Sections 113 to 115 is a governor's proposal authorizing fines against assisted living facilities and specifying uses for the fines. Section 119, 179, and 180 is a governor's proposal establishing the 988 Suicide and Crisis Lifeline. Sections 120 and 121 is a governor's proposal modifying authorization for administrative costs under a home visiting program and authorizing home visiting services for priority populations. Section 122 is a governor's proposal grants for school-based health centers. Section 123 is a governor's proposal authorizing grants to organizations to assist with HIV/AIDS outbreaks. Section 124 and a portion of 203 is a governor's proposal modifying the Family Planning Grants Program. Section 125 establishes in statute the Community Solutions for Healthy Child Development Grants Program. Section 128 establishes in statute the Health Equity Advisory and Leadership Council. Sections 129 to 139 establishes requirements for funding foundational public health responsibilities by community health boards and tribes. Sections 134 to 144 and 146 to 176 modify statutes governing hearing aid dispensing to conform with federal rules on sales of over-the-counter hearing aids. Section 145 expands the individuals authorized to administer opiate antagonists to include school personnel and LPNs in a school setting. Section 185 is a governor's initiative establishing an adolescent mental health promotion grant program. Section 186 is a governor's initiative establishing a program to advance health equity through grants for capacity building in organizations serving diverse communities. Section 187 is the Critical Access Dental Infrastructure Program. Section 190 is the Emmett Lewis Till Victims Recovery Grant Program. Section 191 establishes the Healthy Beginnings, Healthy Families Program. Section 193 is the Long COVID Program. Section 194 removes the sunset for the Palliative Care Advisory Council and modifies the terms of current council members. Section 198 relates to study and implementation of a statewide registry for provider orders for life-sustaining treatment. 199 was a program to provide vaccines to uninsured and underinsured adults. 200 is the Workplace Safety Grants Program for healthcare entities and human services providers. 201 is the Task Force on Pregnancy Health and Substance Use Disorders. And 203, which is the repealers section, the repealers mentioned here are just ones that didn't relate to another initiatives. It repeals a required report, and it repeals the Positive Alternatives Grant Program. That's the end of Article 3.
All right, thank you very much. And as she said, this is a big article. That's a lot of the bill. And I hope folks noted that the bills we heard for the Department of Health that we rolled into a separate policy omnibus bill are also in here. So if that's confusing to anybody, you know, we don't know if they will take up that bill separately on the floor, so those provisions are also in this bill. So that's why some of you may be surprised to see your names on this sheet. Anyway, so Article 4, who's got Article 4?
Madam Chair, that's
Yeah.
also me.
Ms. Clark first.
Article 4, the entire article is a governor's proposal that modifies the medical education and research costs, or MERC program, to comply with federal rules. That's it.
Very good. Article 5.
Article
Ms.
5,
Clark.
Madam Chair and members, health-related licensing boards. The first set of sections, sections 1, 2, and 7, require the EMS Regulatory Board to provide grants to medical resource communication centers. Sections 3 through 5 require ambulances to carry opiate antagonists. Section 6 increases the maximum amount an ambulance service may receive for the education costs of volunteer ambulance attendants. Sections 8 through 14 and 29 make technical and policy changes to statutes governing physician, PA, and acupuncture licensure and practice. Section 15 establishes a licensure verification fee for dietitians and nutritionists. 16 modifies licensure and application fees for marriage and family therapists and associate marriage and family therapists. Section 17 allows a former student to continue to practice alcohol and drug counseling for a certain period of time after the student receives a degree or the last credit received. Sections 18 to 21 allow the Board of Dentistry to charge a fee to provide a mailing address list and also make technical corrections to the dental licensing chapter. Section 22 allows a pharmacist to delegate authority to administer vaccines to a pharmacy technician or a pharmacist intern. Sections 23 to 27 modify licensure and registration fees collected by the Board of Pharmacy. And Section 28 relates to the medication repository program.
All right, thank you very much. Okay. Ms. Sunderman.
Madam Chair and members, I'll be going through Article 6, and I'll be also going through Articles 7, 8, and 9. Article 6 is DHS background studies. Sections 1, 6, 7, 10, and 33 through 36 are governor's proposal classifying information about reasons for a disqualification and a denial of a set-aside of a disqualification, changing the classification from public to private data, and making corresponding changes in Chapter 245C. Sections 2, 3, 8, 27, and 38 are also governor's proposals. These are maltreatment and state licensing agency checks and criminal history checks for guardians and conservators. Sections 4, 11, and 37 are governor's proposal sections regarding electronic access to background study notices and document access through an applicant portal. Sections 5 and 12 relate to the public law background studies for MSOP direct contact employees. Section 9 is a governor's proposal, and this is requiring applicants to update contact information in the net study system. Section 13 is a governor's proposal. This is making the fee increases for DHS background studies commensurate sort of automatically when the BCA fees increase. And they already do this for FBI checks. So this is getting that in line with how they handle FBI fees. Sections 14 through 31, these are all related to the governor's proposal, and these are $2 increases to background study fees for a range of providers. Section 32 is a governor's proposal. This is a tribal adoption and foster care background study fee recovery and deposit provision. And Section 39 is the repealer, and it repeals provisions related to public law background studies and guardian and conservator studies. That concludes Article 6.
Okay. Article 7.
Moving to Article 7, this is the behavioral health article. Sections 1 through 12 are governor's proposals. These modify mental health provider licensing and qualifications, documentation, assessment, treatment plan, and medication storing requirements, all in Chapter 245I. Sections 13 and 25 are governor's proposals. These modify local agency substance use disorder allocation purposes and a cap on the payments. And there's also in Section 25 an evaluation of ongoing need for these allocations. Section 14 is a governor's proposal. This adds hospitals, FQHCs, and rural health clinics as eligible vendors of substance use disorder comprehensive assessments. Section 15, a governor's proposal. This is children's residential treatment provider room and board vendor eligibility changes. Section 16, this relates to the governor's proposal for transition to community modifications. Section 17 and 23, these are from House File 1198. These add assertive community treatment or ACT eligibility criteria for persons receiving the Eligible for Youth Act services who have turned age 21 but still need the services. And they also, this also allows for ACT provider continuity for young adults who received Youth Act services up until the age of 27. Section 18 is from House File 1683. This allows specified MA intensive services providers to include staffing and capital costs in their prospective cost-based rate-setting methodologies. Sections 19 and 20 are from House File 1198. They require training specific to families and children for mental health crisis services providers. Section 21 is from House File 1683. This allows shared site settings for services that are related to but distinctly separate from psychiatric residential treatment facility services. Section 22 is a governor's proposal. These are psychiatric residential treatment facility startup and capacity building grants. Section 24 is House File 346 amended for the 4% bridging rate increase for outpatient MA and Minnesota Care Services that are included in a rate analysis authorized 2 years ago. Section 26 is a governor's proposal increasing mental health adult day treatment rates. And Section 27 is also a governor's proposal. This is related to Behavioral Health Fund room and board rate schedule. It's an update for children's residential treatment facility placements that are not child protection or delinquency placements. And that concludes Article 7. Moving to Article 8, the Department of Human Services Policy Article. This corresponds to Article 2 of House File 2050, the first engrossment. This was the Health and Human Services Policy Bill. So Section 1 removes intensive community rehabilitative services from the list of eligible services for adult mental health grants. Section 2 just inserts a cross-reference. Section 3 codifies the existing cultural and ethnic minority infrastructure grant program. And a note on this, there's one aspect of House File 2058 that it adds interpreter services in certain mental health, inpatient mental health settings to the list of allowable grant activities for those grants. Sections 4 through 7 codify existing grant programs. Sections 8 and 9 list authorized uses of grant funds and program outcomes for the Transition to Community Initiative. Sections 10 through 13 move the definition of medical assistance room and board rate from Section 256I.03 to a section in Chapter 256B, I believe. And then the remaining sections make conforming changes related to that move. Section 14 defines date of application in the chapter governing general assistance. Section 15 modifies general assistance application requirements and the timeline for the first month's grant. Section 16 modifies the definition of supportive housing. Section 17 defines date of application in the housing support statutes. Section 18 modifies the date of eligibility for housing support payments. Section 19 modifies housing support application requirements. Section 20 adds multi-tribal collaboratives to community living infrastructure grants. Section 1, similarly to other sections, modifies date of application, but this time in MFIP statutes. Sections 22 and 23 make conforming changes to MFIP and diversionary work program application requirements related to changes in statutes for economic assistance eligibility and verification. Section 24 defines date of application in the chapter governing economic assistance eligibility and verification. Section 25 outlines application requirements for programs governed by the economic assistance eligibility and verification chapter. And section 26 is just a revisor instruction, and 27 is the repealer of the section that was moved earlier in the article. That concludes Article 8.
Okay. Thank you. Article 9.
Moving to Article 9, this is the Department of Human Services Operations Policy article. This corresponds to House File 2712, which was the DHS policy bill, operations policy bill carried by Representative Fisher. So Section 1 modifies data practices provisions related to licensing of specified programs. Section 2 modifies MNsure Navigator background study requirements. Section 3 makes clarifying changes related to educator and administrator licenses background studies. Section 4 expands the definition of controlling individual for purposes of DHS licensing. Section 5 modifies the definition of owner for purposes of DHS licensing. Section 6 requires licensed applicants to provide an email address that will be made public. Section 7 requires licensees to include public email addresses and add circumstances under which DHS is prohibited from issuing or reissuing certain licenses. Section 8 requires license holders to document a background study subject's first direct contact with the person served by the program. Section 9 modifies DHS processes for determining licensing sanctions after a final order affirming an immediate suspension. Section 10 allows DHS to suspend a license if a program served, or a person served by a program is at risk of harm while there are ongoing investigations or judicial proceedings related to a final licensing sanction. Sections 11 and 12 make technical conforming changes. Section 13 removes language related to family child care background studies performed by county or private agencies. Section 14 prohibits a license or certification holder from using a prone restraint on any person in the program except under specified circumstances. Section 15 clarifies that a child care contractor is a background study subject if the contractor is providing services for hire in the child care program. Sections 16, 17, and 18 add definitions or modify definitions in the background studies chapter for entity, employee, and volunteer. Section 19 is technical conforming changes. Section 20 adds a reference to the BCA consent and self-disclosure for purposes of background studies. Section 21 requires specified employment agencies to employ the individuals providing direct care services and applies requirements, background studies requirements to these individuals. Section 22 is technical changes. Section 23 provides that DHS is not liable for conducting background studies on certain individuals who have not been submitted or not been removed from a licensee's roster in the system. Section 24, again, adds a reference to the BCA consent and self-disclosure. Section 25 adds criminal history disclosure form to alternative background study requirements. Section 26 adds language allowing an acceptable form of identification as determined by the Commissioner for Background Studies and clarifies requirements for background study subjects aged 18 or older and 17 or younger, and adds, again, the criminal history disclosure form. Section 27 modifies requirements and makes clarifying changes regarding fingerprint and photograph requirements and FBI checks for background study subjects aged 17 or younger. Section 28 specifies that an entity with which a background study subject is seeking affiliation must initiate the background study in Net Study 2.0. Section 29 adds temporary personnel agencies to the list of agencies that are not allowed a single background study to be carried across licensed programs. Section 30 makes a technical change. Section 31 provides the DHS must recover the cost of any background studies initiated by a personnel pool agency. Section 32 removes language regarding variances for specified foster care program consent. Section 33 removes a paragraph that exempts individuals from submitting a study for specified programs from the requirement that the commissioner notify a health-related licensing board of a finding of substantiated maltreatment. Section 34 removes the requirement for DHS to submit to the county or private agency the dates of adoption-related background studies and the names of agencies that conducted the studies. Section 35 prohibits certified license-exempt childcare centers from using prone restraints on children. Section 36, this is for mental health provider certification, adds language allowing the commissioner to require the applicant or certification holder to provide a public email address. Section 37 makes clarifying changes for appeals of inpatient hospital services to, that are determined to be medically unnecessary, and specifies that the medical review agent shall make a recommendation to the commissioner. Section 38 removes language regarding appeals of reconsideration decisions for inpatient hospital services determined to be medically unnecessary. Section 39 is, adds the definition of medical review agent and specifies medical record review requirements and administrative reconsideration requirements. Section 40 is a clarifying change. Section 41 modifies sanctions under MA and expands the individuals against whom DHS may impose sanctions, and does other items related to sanctions under MA. Section 42 specifies that the commissioner is allowed to access medical records for fraud investigations in the manner and within the time prescribed by the commissioner. Section 43 removes the Department of Education from the list of agencies for which DHS must provide a court-specified licensing agency data for guardian and conservatorship purposes. Section 44 instructs the revisor to reorganize, and Section 45 repeals statutes and rules related to some changes made in the rest of the article. And that concludes Article 9.
All right, thank you very much. Article 10?
Madam Chair.
Ms. Millie, welcome. We don't see you very much in this committee.
No, Madam Chair, not anymore. Article 10 is the economic assistance article. It begins on page 458 of the DE if you're looking at the language in the bill. Sections 1 through 4, 10, and 11 are related to the governor's proposal called Addressing Deep Poverty, which modifies general assistance benefits by aligning them with the MFIP transitional standard for a single person, modifies general assistance by allowing for more time for recipients to apply for federal benefits that they may be eligible for, and it also modifies the drug testing requirements for various economic assistance programs. Sections 5 through 7 and 9 are related to the governor's proposal related to recipient lived experience engagement. It provides a definition for that term, and then it exempts recipient lived experience engagement from the personal property limits under the economic assistance programs. Section 8 is a governor's proposal. It removes tribal per capita payments from income calculations for the economic assistance programs. And that concludes Article 10.
Thank you. Article 11.
And then Article 11 is housing supports. Section 1 is from Representative Hers, House File 732, and it's also a similar governor's proposal, modifies housing support countable income. And then Section 2 is a governor's proposal related to housing support presumptive eligibility. And then I should also mention there should be another section in this article that I have not included that goes along with the housing stabilization services modifications that are being carried on the spreadsheet.
Thank you. And Article 12, who gets miscellaneous?
Madam Chair,
Mr.
Article
Chun.
12 is miscellaneous. Sections 1 and 2 and 13, these require health plans to cover additional diagnostic services or testing after a mammogram with no enrollee cost sharing. Sections 3 and 12 limit cost sharing for prescription drugs prescribed to treat chronic disease and also related medical supplies. Sections 4 to 7, 10, 11, and 14, these repeal a section of law that makes the possession of drug paraphernalia a crime, makes conforming changes, and modifies provisions regarding the possession, control, and sale of hypodermic syringes or needles. And then finally, sections 8 and 9 allow an individual tax identification number to be used as a valid ID for the emergency and continuing insulin programs.
All right, and that brings us to the end of this bill. So, any clarifying questions right now for our wonderful, hardworking, nonpartisan staff? Okay, not seeing any. So I would just say that, like any omnibus bill, this one no doubt contains errors, especially member errors, less likely staff errors, although there are always some. And, this is a very big, complicated enterprise, and as it goes through the process, it needs to get closer and closer to perfect. And so, as always, there will be an author's amendment, I'm sure, and to correct some things. And so I know, I want to repeat again that in any omnibus bill process, there's always a lot of disappointment. There's excitement and there's disappointment, right? Because we never have the money to do everything that everyone wants to do. And so but that said, there are things that maybe should have gone in that were inadvertently left out or that we didn't understand it well enough. And there are probably things in here that maybe shouldn't be in here. So we have like another day or so to kind of discuss a little bit. I'm not inviting people to all come and complain about whatever they wanted that isn't here. I'm definitely not doing that. But if you believe that we didn't understand something, that, there's a nuance here we missed, I do invite you to reach out to us, either to me or to one of the other members, because that is how the bill gets better as it moves along. And of course, just as members know, so we will do the markup process, and then the bill will go to Ways and Means. There's always some kind of amendment there usually to align the spreadsheet. There are more minor things there. There's another amendment process possible on the floor. There will be a conference committee on this bill. I promise you, the Senate does not have exactly the same bill. And I think in the conference committee process, too, a lot of the provisions in this bill will get further work and attention from a lot of folks. So really appreciate everyone's contribution to this process. It is truly a group process. And the more good folks who pay attention and give their input, the better it will be and the better it will work for Minnesota. So this bill does a lot of great things for the people of Minnesota, and I am really so honored to be a part of this process and just looking forward to the rest of the process. So with that, we will let everybody get back to work, and we will meet tomorrow at the regular time. Now, just to note, tomorrow's not our regular meeting day, but it's Wednesday, but we are meeting here 10:30 a.m. to take public testimony. If anyone from the public who wants to testify, please reach out to Mr. Sandy to let him know and get on the list. And with that, we are adjourned.